This episode is being brought to you in part by Real-Time CTMS, a leading provider of innovative software solutions for clinical trial research sites, site networks, sponsors, and CROs. If you're a research site, you need something to help you run your business. Real-Time can help you manage your patient recruitment funnel, make sure you keep your patient visits in window. It provides eSource and eReg solutions. We're able to make stipend patients to our patients, and we're also able to track all the financials connected to all the patient visits and other various things that happen throughout the course of a clinical trial. If you're not using Real-Time CTMS, you are likely losing money. Make sure you go check them out at realtime-ctms.com and complete one of their contact forms to receive a demo today. Hello and welcome to the Note to File podcast, a collection of interviews, best practices, and candid commentary for clinical research sites. I'm your host, Brad Hightower. Our guest today is Derk Arts. Derk has 15 plus years of experience in medicine, research, and technology. He founded Castor to solve the biggest issues in clinical research today: a lack of inclusivity, patient focus, and impact of data. Castor enables sponsors worldwide to run patient-centric trials on a unified platform that helps them maximize the impact of research data on patient lives. Derk believes the key to achieving lasting change in the industry is through scalability and standardization. In this episode, we discuss the current state of clinical trial technology, standardization of clinical trial data, the unleveraged power of research sites, the future of the CRO industry, and so much more. A really great conversation with Derk. I had a really great time, and I think you'll pick up some really nice, interesting tidbits here. So without further ado, Derk Arts. All right, Derk Arts. Thanks, man. Appreciate you coming on. I know we've been trying to set this up for a while, so thank you.
Yeah, thank you. I'm excited. It's been a while, so I have some time for the excitement to build up.
Yeah, indeed. And I know we were just talking beforehand. You made a big move recently.
Yes, that's true.
Yeah, so welcome. I'm glad. Probably makes it easier to do these types of calls, to be on these same kind of time zones. Yeah.
Yeah, for sure. I really look forward to. So, for context, I moved my family to New York, to Brooklyn specifically, and I really look forward to being able to join a lot more of these events and just spend more time meeting people in person also, which is going to be a lot easier.
Sure.
So yeah, happy to be here.
Right on. I'm going to jump in just like I always do. I'm always kind of curious to hear people's kind of backstories and sort of what brought them to, the sort of clinical trial space. And I know that yours may be unique, as all are. So if you would, just kind of tell us a little about your backstory and kind of what brought you to the clinical trial industry, if you would.
Sure. So I'm from the Netherlands. I studied in Amsterdam. I studied medicine. So technically, I'm still a medical doctor. I always had this sort of entrepreneurial spirit. So I always did something on the side. During my medical training, that was mostly building websites. And that sort of evolved into building little solutions for problems I encountered during my internships in the hospital. And the final internship in the ICU, the problem I encountered was Excel sheets being used for data capture into a clinical trial. That was about weaning patients off ventilation. My dream was to become an ICU doctor, anesthesiologist. But with my web experience, I realized that it was just going to be horrible to use an individual Excel file for each patient. So I built a little website to help with the trial, to capture data, to streamline the whole process by the bedside. I started asking around why nobody had a solution in place for that. And the answer was we don't know how to code, we don't have any money. So I was like, all right, let me just make this platform available to everyone. So during my PhD, I decided to do a PhD first, mostly because it would make it easier to get into specialty training, and it would also give me time to sort of deploy that entrepreneurial ambition a little bit more. So one day a week, I worked on what at some point was called Castor. Initially, it was called a different name. And that turned into, I think, the most user-friendly, scalable EDC platforms, or at least for like PhD students. So this is the early years. This is 2012 to 2016, basically. And so in 2016, I graduated, or at least I defended my thesis, and then decided to just go full-time with Castor, and actually more and more start to focus also the technology and the platform on commercial side. So I think for the past 5 years, we've been just completely focused on like life sciences. But with my academic heritage, And of course, the backstory of Castor, I always felt it's very important to make sure that our technology is still available for anyone, because I don't see how you can change the world if you're just going to sort of build the Ferrari for the elite. So even though the entire business is focused on commercial trials these days, we still have a ton of academic studies starting each month on the platform. And that's something I'm actually quite proud of. But so, yeah, it's been medicine, academia, and then ultimately just the business that pulled me into life sciences and into the clinical trial space. And, there's a lot of things still to fix. And I'm super excited about fixing those. I think for me, the journey should extend beyond just clinical trial technology. Like building the best platform for running a modern clinical trial is awesome. But I think we need to think beyond that. What is evidence-based medicine going to look like, or what should it look like, right? For it to be truly evidence-based medicine, which I think often it is not these days still. And how can we maximize the impact of all this precious clinical trial data from both like the pure commercial trials and the academic trials? And that's really my passion, building the best technology platform with a focus on technology, but also really thinking beyond that. How do we maybe leverage machine readable data to make better decisions about patients? My PhD coincidentally was about clinical decision support systems and using real world data and other data sources to do that. So my big picture that I'm trying to work towards one step at a time, more of an integrated system between healthcare and clinical trials where data flows freely and is fed directly into optimized prediction algorithms to ultimately make sure that the right treatment ends up with the right patient and in a completely unbiased way. And we're quite far from that, honestly, if you know the system well. So anyway, that's how I ended up here.
Fair enough. So first of all, let me say apologies, Dr. Arts. So I didn't realize you're a medical doctor. So that's awesome. I love that. So I mean, let's go. Let me ask sort of maybe a naive question, but maybe you can give some insight into. How did we sort of end up in the current state of things in terms of clinical trial technology now, where commercial trials are done across all these sort of disparate platforms that some talk, some don't? It feels like a real chaotic mess, right? And even then, I mean, some sites are still using things like Excel spreadsheets. It's wild, the sort of lack of consistency and, again, the just disparate nature of clinical trial technology. I mean, how did we why? Do you have any insight as to sort of like how it came that this is how, we've accepted the way, this is how we do it?
Yeah, well, it's a big question, of course. I do have some ideas. I think it's also still paper, right? I mean, this.
Yeah, absolutely.
Paper, Excel, it's crazy. I think we set out with like the right idea when everything was just paper-based. There's obviously a big advantage to sort of digitize the process. But I think what we didn't really do well is rethink the process. I feel like in the early days, and this is probably, I don't want to blame like the regulatory burden too much, because I feel that's like the easy way out to just say, oh, well, innovation is difficult because of the regulatory burden.
Sure.
But I do think that people were maybe a little bit more mindful of what they wanted to try. They were like, well, this works now, so let's see if we could just make that digital. And I think, unfortunately, that set us up for a whole host of platforms that weren't actually changing the paradigm or changing the process itself. They were just digitizing it with some obviously tangible benefits. But that also kind of, I think, dug us into a hole of everybody getting used to now having an electronic platform to do basically the same thing. And those platforms also not really being built in a modern way, because, of course, it started, 20, 30 years ago. I think we really started off on the wrong foot a little bit. We didn't start with like, how do we reinvent the space? We just started with, we have a ton of paper here. Let's just see if we can replace that. So on the one hand, you had someone working on eTMF. On the other hand, you have someone working on EDC. And then you have someone working on maybe payments. And all these companies were just doing that. And I feel right now we're in the age of how can technology really change the paradigm and do things differently. But we are so deeply entrenched with like generations of old technology where there's also really not a huge drive to replace that. I mean, the risk averseness, for obvious reasons, right, is just very high. So once you have your paper replacement technology functional, you want to maybe run with it for 10 years. I mean, I see this maybe 20 years even, right? And I think so the combination of those two factors, the risk averseness and the lack of enthusiasm to replace technology once it's implemented and functional, and the fact that we started off with just fixing the paper problem as opposed to the entire process, I think got us to this place. And I think now it needs just a very disproportionately big effort to make significant change on open systems that communicate, where we put more power with the patients. Of course, everyone's excited about DCT, and I know you speak about that a lot too, but you can just see how slow all of that goes. And yeah, we're going to just have to keep at it. But I think those are sort of my two factors. And ultimately, yes, the regulatory burden is driving that, because that is making people a little bit more risk averse. But I think it's just an unfortunate combination. But I do think we are moving in the right direction, and we can learn a lot from other industries, because I think a lot of industries have gone through this, but I think they've been a lot better at moving faster and seeing hey, actually, how do we now really start to go beyond what the original process was and reinvent the space with technology. And I feel like we're kind of in the midst of that still.
Yeah, no, and I often come off as pretty cynical when I talk about DCT and all the technology that's coming to the forefront. I am actually pretty optimistic about it all. I mean, and in that vein, I mean, do you feel like will we see the death of EDC as we know it? Do you think, as time goes on? I know there's a lot of talk about direct data capture and these more fully integrated platforms. I mean, do you think we will truly see that methodologies take over more versus these, again, sort of really just digitized versions of paper processes?
I mean, if you define EDC as eCRF with source data verification, then I think, and you define death as, less than 10% of trials use this approach, then I think yes. I think EDC can be a lot more, but I'll also admit that we started speaking more and more about CDMS, because we don't want to sort of have a hard association with eCRS, because I do think specifically eCRS with source data verification, I mean, there needs to be, if you just focus on the first principles approach, then there's going to be a future where that just doesn't make any sense. There needs to be a future where fossil fuel just doesn't make any sense anymore. It's really hard to say when exactly, but solar energy is getting so good, and then there's still also nuclear energy options. At some point, it's just going to happen. There's just really no way around it, because the benefits are just incredible. But it's going to take a long time for a vast number of reasons. And I think here it's the same thing. At some point, it makes total sense that you have pure electronic data sources, either the EHR, some kind of wearable, direct data capture. And I think that's actually the more interesting question. Is manual data entry going to go away completely? I think that's going to be way more difficult, because we do not really have an interface for every type of data. The interface between two human beings, whether they are remote from each other, which I think is an obvious improvement. In some circumstances, actually being physically together can be very nice, of course. That's going to be pretty hard to completely rip out. So do I think manual data entry or direct data capture is going to go away? That is going to be very difficult. Do I think eCRS with source data verification will go away? I do think that will happen. I wish it would happen faster, but also, that's also going to take a lot of time. So yeah, that's my nuanced answer to that question. But in the end, the short answer is yes.
Fair. Yeah, no, I wish it would happen faster too, myself, because I mean, as you allude to, I mean, at the site level, you're really doing mostly everything twice, at least. Right. I mean, you're either putting it on paper and then putting it into an EDC or eCRF, or it's, you're transcribing it out of an EMR and into an eCRF. But no matter how you slice it, you're still doing it two times, which seems mind-boggling when you think about the scale and how many trials, how much data is being collected this way. It's again, it's disappointing to think that we're sort of still doing it the same old way. And I guess tell me a little bit about how Castor is sort of addressing this, and maybe in terms of, is it a full platform or sort of what's the approach? I'm really curious to know more about Castor specifically.
Yeah, well, we want to be a full platform, but obviously you got to focus. So I think that's really something this industry also struggles with. I think embracing data standardization, open APIs, etc. That's actually the solution we should follow, combined with focus, as opposed to being we're going to try to do everything and then we don't need APIs. Well, that's just bullshit. That's never going to work. And so we are trying to create a platform around sort of some of the core workflows in a clinical trial. And so for me, it's really about how do you create a single platform that can do some of those core functions, as in enrolling patients, consenting them, and then capturing data on them and reporting on that. And, I think that's a pretty big piece to pull off. And then how do we partner with service vendors and other vendors to complement that? So how do we create the best possible APIs to make sure that we can be at the heart of this ecosystem. And so for us, typical journey just in these modern days start with these landing pages for clinical trials where there's high-level eligibility criteria where patients can enroll themselves. They screen themselves, so there's a pre-screener usually. And if they pass that, they get invited into the e-consent system. And if there's a remote consenting setup, then there's a televisit happening to consent the patient, and then they get enrolled into the CDMS. And then you have your choice of options. Typical, there's still, of course, is the ECRF option because we started out as an EDC, and that, as we discussed, is slowly moving away. But of course, we are very happy when we see our customers just doing direct data capture and avoiding source data verification. We have a few trials that do AHR connections, but there's just so many vendors, so many attempts at it, so many projects, but it's still not really going. But it's definitely part of our focus to make it go with a number of partners. Ultimately, HR data quality is a whole topic we can spend hours on. But there's more to it. It's just also the nature and who owns the technology, et cetera. A big discussion, but we have trials where this works. And there's, of course, ePro, which I think is great. And then one more broadly defined eCOA, also looking at some of the other players, like maybe a caregiver. And so really what we're trying to create is, what we have created, I would say, is one platform where you can just have all these different modalities of data come together and being earmarked as such as well. So they're all different sources, but you'll be able to distinguish between them on the platform and report on them. And making that really scalable. I think that is the critical factor. Like, how do we ensure that whatever we bring to the industry can be deployed easily and at scale? Because I get it. Like, if you have a year lead time and you charge millions, then you can deploy anything. But I don't think that's really going to help the industry, right? So I'm thinking, great, let some of the other players have some of those projects. I'm very happy to focus on the repeatability of it, right? So DCT as a study design philosophy is going to fail if we don't have scalable technology supporting it. So for me, it's really about I would turn something that is really new and complex with all these moving pieces from enrollment to screener to consent, and everybody wanted to do it slightly differently. How do we sort of standardize it a little bit and make that configurable so that at some point we can go to a CRO and sponsor, say, you know what, here's the technology platform. You don't need us. You can work with us. You don't need us. And you can just do this yourself. And for each trial, you have flexibility, right? And I think that's the point of having a platform approach. You do not necessarily always need 5 vendors. Like, you at the core, you have a set of functions and modules that you can use to cater to most of your trials needs. And then you can expand on that. So you bring in a specialty patient app, for example, that does more than regular ePro, or you bring in some kind of a wearable, for example, or some kind of patch that generates data that isn't from the Castor offering. But that's the whole point. Like, how do we make sure that we create a pluggable platform where we are the foundation, but we recognize we can't do everything. So that's really the approach, making sure we have the most scalable platform for a modern clinical trial where you still have the flexibility to sometimes, use ECRFs because, the sponsor, the protocol demands it. I think that's just the reality we live in. And I think that's the interesting challenge. How do you continue to innovate while also recognizing what everybody actually is still doing on a day-to-day basis? That's an interesting challenge. And I think you need to do both, right? Create that platform and then work with your customers and with the industry to push them into the direction of, okay, let's try more e-consent, let's try more direct data capture, let's try more ePro. And I think that's happening. I think we all as vendors together are making that happen, but slowly.
Sure. Well, and that's, I kind of want to unpack a couple of things in there. One is sort of the concept. It's interesting to me is, how do you see the future? Is it still potentially a bunch of vendors connected through APIs and some sort of data standardization? Or is it that we see a couple of platforms really rise to the top through consolidation or whatever the case may be, to where, it's not, we don't have 100 different vendors all competing in the same space. If you look right now, it looks crazy, right? There's just people popping up all over the place, getting funding, doing God knows what in some cases. And especially if you're a site, you're like, well, shit, this looks bad. This is going to be more pain before it gets better. But I've heard sort of both ends of the discussion is, yes, the future is going to be having these APIs and connections so that we can use all these different systems, or that maybe we don't want that. Maybe it's better to have fewer systems that do more. Is that how does that sort of jive? Do you think, how does that play out in time?
I think we'll have a more limited number of core platforms, but I think we'll have still a very large number of extensions that build on that. But I think right now we're not there yet. I think there's a lot of I want to do this myself still going on in our industry, which I think is a bit naive. And I think other industries have figured out you can actually be a lot more successful together sometimes. Like we switched to Salesforce a while back. I am not a huge fan, I got to say. But what I do think is just super impressive is the crazy number of plugins you can just like pull from a marketplace, basically, to run. And then those are entire businesses on their own that are just really successful. And I think that level of standardization and integration off the shelf is what we should be thinking about. So a number of core platforms, and then everybody can have their own sort of space. It's not a zero-sum game. We can be successful together. But how do we make it very easy for a sponsor CRO to say, oh yeah, I want to use that piece and I want to use that piece, and then going to integrate it on one of these core platforms. Right now, it's every time it's just a nightmare. And I speak to a lot of sponsors who say, oh, we just want a single vendor for all these things. And I completely understand why, but I do think you're never going to get like the best solution like that. You're going to always compromise because you're basically committing to someone who's not focused or who has made various acquisitions and poorly integrated them, which I think is probably the most common pattern. I just don't think that works really well. But we need to really embrace standardization. Like, how do you express consented status of a patient in a standardized way? We have a beautiful standard like FHIR, HL7 FHIR, to exchange medical information specifically, medical data even. But we still don't really have great ways for these clinical trial systems to communicate. So even though we have an API, our API uses our provides like our own formats, basically our own JSON formats. Actually, that's bullshit, right? Like we should be using some kind of standard language that if we send a message to pick any random vendor, they understand it too, that we don't have to translate everything. So I was actually dreaming of creating a standard for particularly like e-consent communication, because I think that could be something that the site owns. But then if the site owns it, the technology, how do you connect it to the sponsored technology? And now obviously you want to start to standardize that. So I think we need a lot more thinking on how do we create standards for communication, and then how do we start to really embrace that as opposed to being like, oh, let me just buy this e-consent vendor, take it off the market, add it to my portfolio. Oh yeah, but the integration effort is just ridiculous. So we're just going to have sort of separate accounts and data silos. Like that's not helping the industry. But it's good for business, I guess, at least on the short term. Until in the long term, everything starts to fall apart.
Right. Well, and I like you kind of dovetail into sort of my next question too, is what do you see the role of sites in the way technology evolves? I mean, sites are super diverse, have different levels of, ability, resources, whatever the case may be, use different systems. I mean, to what degree will they have more or less control as the future moves on? I mean, as it stands, sites use whatever the sponsor tells them to use. They don't really have a choice, right? If they say, you're going to use Rave, well, you're going to use Rave. You can't say, well, no, I want to use Inform or whatever the case may be, which why would you ever say that? But that aside, again, there's really no much say from the site side. Do you see that changing or evolving in any way, or really kind of just still remaining the same, since sites are really the tend to be the least cash rich stakeholder in the game?
I mean, I'm not sure if cash rich is the main factor. I think it's just that the paradigm we're used to. I was thinking like sites are just like unionized or something. But I mean, you have all the cards in the end, I think, right? Like maybe the sponsor has the cash, but you have everything that the trial needs to succeed. And sometimes the responsibility also to enroll and to recruit patients. And so I do think there's actually a lot of power with sites. I'm just not sure if it's being leveraged effectively. I think historically, again, we've just seen sponsor as a project goes to the site, says, I'm going to pay you a lot of money, and you just do it my way. I think, like, I'm also a huge fan of platform trials, for example, like the one we did with the World Health Organization, but I've seen many others. And I see slowly here and there these initiatives starting to emerge to create like an existing infrastructure where things like, for example, why is it so hard to get EHR integrations with the EDC to work for a study? Well, study is usually transactional, like it starts and it stops at some point, and the effort to get this done and to get it through privacy and legal is so large, it just doesn't work like that. You need to have like a strategic initiative to deploy it. So I think as soon as start to really be like, I build up my own repository of patients, or I'm tapped into some kind of repository of subjects so I can enroll faster, I can link directly to the records. As eSource, push that to you because we've adopted standards. I have my own e-consent technology in-house. Everybody's been trained on it. I know I can consent patients in like 5 minutes on this technology, and I'm going to give you this proof that I've done that and that the FDA feels very comfortable with. I think that could change the dynamic, but again, it's going to be slow, and it's going to require a lot of proof that this is actually worth considering for a sponsor. So the efficiency gains that you as a network of sites would have to prove would have to be pretty significant. But I think sites can be more powerful, and I think standardization at the site level of technology is potentially very, very powerful. Something I'm very excited about. But if we don't solve this connection to sponsor tech, then it doesn't work. Like I know actually, there's a ton of this. There's quite a few vendors that sell to sites specifically. Funnily enough, what we used to do back in the old days, what we kind of stopped doing, I would love to get back into, but then they're still manually copying the data. So the site owns the system for eSource, for example, but then they're still manually copying data, and I'm like, what the fuck? That's absolutely not how it's supposed to go. So we need to solve that problem, because if we can't easily push consenting status and consented patients into a sponsor platform, or push eSource data into a platform like without any question about data quality, it's going to be really tough, I think. So there's some things that need to be solved, but I think again, there's all the power with the sites.
Yeah, well, no, those are again a lot of good points there. One is that yes, I mean even the sites, even the technology that sites sort of own isn't really moving the needle, because to your point, I mean I still have to go enter it again somewhere else. So it makes it very, it's very incentivizing for me to get the latest and greatest in eSource, because it doesn't make my job any easier, and it costs more money, and it's a bigger pain in the ass to set up from scratch. And again, maybe that's just where we are in the evolution of things, and that will change over time. And to your other point, I mean, yeah, you're right. I think sites have a lot more leverage than they think they do. I think that getting sites on the same page is a weird challenge for whatever reason. And also kind of leads me to my next question is, do you see the role of sites changing significantly with the advent of more DCT, sort of methodologies? Like, does the site become less important? Do we need less sites? How does that sort of play out in a world where things are getting further away from the sites?
I mean, if I were running a site business, I wouldn't want to just sit back and be like, well, it's everything's going to be fine. This is all okay. My business is not going to change. I mean, that's usually a bad idea anyway for any business. But I think in this case, and by the way, I think the same thing is true for CROs. But what I'm thinking is you need to just sort of make sure that you're still going to be relevant, like in a new paradigm. And this paradigm, I think, is going to be a lot more nuanced than what a lot of people have claimed. I think it's pretty clear by now, and I know I'm repeating like one of the talking points that has been repeated 1,000 times on like 1,000 DCT webinars that everyone I think is pretty tired of. But patients do like to sometimes go somewhere and meet a person. Some patients don't, and some patients do, and then we like to say they want to offer them flexibility, which I think there's a reason people have said this so many times, because it's really a good idea to offer flexibility. It's like, do you want to come to a site? Great. But I do think sites would be wise to prepare for specializing a little bit more. Like if all you do is go through an assessment together, well, I think it's a pretty easy sell for a patient to say, well, let's do that on a call like this, right? Like I still see you, I still feel like there's some kind of human interaction. I still have someone holding my hand going through some kind of complex questionnaire or assessment. But like, I think there's going to be a whole very large group of trial participants or patients that are specifically the newer generation are going to be like, I'm like, why do I need to come to you for that?
Right.
And so I think if sites can make sure that they can still do that for that small group, that I think this group is going to get smaller, that really wants to just be there, have a coffee, and then go through the questionnaire, great. But the majority of things is going to be like, I have to actually come to a site for this. And so what is that? What is it you do best? What do you specialize in? What are your niches that you make sure that you own? So that's how I see it. So then you'll have for more of a hybrid model, because you also have the CVSs and the Walgreens to deal with for some of the basic thing. I'm like, that's a whole debate. Like, let's see how it plays out. Like on paper, it's super exciting. Like, get them all involved. Go to the CVS Minute Clinic. I think that's theirs, right? I've only been in the US one. But I mean, and then I get your blood pressure measured and some other things done. Theoretically, it could work really well. And so what does that look like? If you're a site and you fast forward 10 years, what does that look like if we assume some of these things will play out, that people do like remote visits for simple things, and we are able to do some measurements at home, or at least we can go to like the nearest CVS or Walgreens to get some basic shit measured? what is left. I think there's going to be a lot left, but I think you should start thinking about what is that and how do I run my business on that.
Yeah, no, that's fair. I mean, do you sense that sites are sort of like apprehensive about DCTs? I mean, I feel like there's still, again, sites are like a weird bunch, right? Easily kind of spooked by new stuff. Very, again, just because of the sort of historical situation we've been in where we feel, I think sites often feel very much at the whim of the market in a way and not necessarily driving it. But do you think sites are apprehensive, and do you think that apprehension could inhibit DCT as it continues to unfold, or will it again we'll find people like CBS who they don't care necessarily. I mean, this is new for them anyway. They don't know the old way, so for them, I mean, DCT is just as good as any other model.
I think in any line of business, in any industry throughout history, there's just been companies that are like what I just described. Like, this is fine. It's not going to change. I'm going to be fine. And then they're fine for the next 5 years. And then suddenly they hit a roadblock because actually things did change and they didn't really notice that their pipeline was drying up, but they weren't paying attention. And so I think there's going to always be a lot of those who are like, this is moving so fucking slow. Like, why would I care about this? Well, I mean, I would say care a little bit more about it every year, make progress, have a strategy. Because you can't ignore the world changing, even though it's changing very slowly, like imperceptibly slow. It's still changing. I do think that is happening. I'm not sure if that would slow DCT necessarily. I think right now, I think if sites start to embrace DCT, they can actually help accelerate it. I'm not sure if they can really slow it down, because I think the sponsor can be like, I want to do this way. I want to do like the fancy patient-centric approach, and this is how it's going to happen. And site, I just want you to do this, and the rest I'm going to run through this awesome technology. I'm going to use this amazing Castor platform to do XYZ at home, and then they'll come to you for this. But I think as a site, you could also say, if they come to you and say, hey, this is a trial, it's very sort of traditional, you could say, hey, by the way, I think we can actually do these visits remote. So I think you could maybe be in a driver's seat, because you as a site could say, actually, looking at the protocol, maybe there's things we can do better. But I think if a sponsor comes to you and says, well, this is how we're going to do it, then again, like per your point, historically, what are you going to do about how are you going to convince the sponsor to bring a visit back to the site? That's going to be more difficult, I think. So I think they can help accelerate it. Slow down will be a little bit more difficult, unless you just flat out refuse to do the trial. Then, of course, but that I think would be bad for business.
Yeah. And I don't disagree. I think in a lot of ways, there's a lot of value, even for sites, to move a lot of these visits off their plate, so to speak, and kind of out of their space. But again, I think that's still sort of not maybe it doesn't feel like a foregone conclusion to a lot of traditional research sites.
Yeah, I asked you if I could at some point internship with you at some point. I still would love to do that. Like, one thing I don't know exactly, like I know in medicine how remuneration works, at least in the Netherlands and a little bit in the US, but I'm not sure if you get like paid more for I'm assuming you do, for like the complex visits versus the simple ones.
Well, yeah, I think that's an initial like sort of visceral reaction, I think, when sites have to DCT, like, oh, well, if I'm not doing the visit at my site, I'm going to lose a big chunk of revenue. And again, a lot of sites aren't necessarily balling out to begin with. Obviously, some are, but a lot aren't. So I think that's an initial like, oh shit, well, this is going to potentially immediately infringe on, our potential success. Now, the upside might be, maybe I can enroll 3 times as many patients because I can reach further. I can reach into better areas that haven't been reached before. Or again, it's just easier for patients to participate, so we can really up our enrollment rates. But again, I think that's not been well shown to be the case yet. But to your point, I think that's a concern for sites for sure.
Yeah, I've seen. I think it's happened already in the US, but at least in the Netherlands, what I've seen is, like for example, in cardiology, you have like these clinics, and they pick up all the simple stuff, which actually is worth like less in a sense, but because they've optimized it so much, they're still actually a better business than the complex care. But that's also because the complex care is handled by the big academic hospitals that just really struggle to be efficient. But I think there's something there, right? I think even though you are potentially moving things off-site, if you're still doing it yourself, you actually have an opportunity to enhance the margins on that specific activity. And actually, you're better off embracing these things as opposed to thinking you're going to lose a revenue stream. But yeah, I mean, if you're just sitting back and letting the outside world decide everything for you, you're probably going to lose some revenue. And then you still have an opportunity to, through economy of scale and optimization, focus on those more complex visits. But those, by their very nature, are going to be a little bit harder to optimize for and to create economy of scale for. So I think that's an interesting point to think about. But yeah, it's going to be an interesting world for everyone. It's CROs are also going to struggle with a significant reduction in SCV. Like, for example, that's a huge revenue driver for them. So they need to reinvent themselves.
Well, and that's an interesting point too. And I've asked people this before. I mean, do you see like these DCT vendors sort of infringing on CRO space, in just in the way you describe it? I mean, a lot of things they do kind of make a lot of what CROs do not as valuable anymore. So, I mean, also to that end, do CROs, I mean, is it really in their best interest for DCT, or are they just going to have to evolve, like you say? I mean, what's the, it feels like it's at odds with that business model to at least some degree.
I think it's at odds with the traditional business model. I think it doesn't have to be.
Right.
And now you see a lot of these sort of mixed companies also, right, that are like half CRO, half tech company, which my personal philosophy is that it's really difficult to do it well, because you have to do two very different things well, and they're two different business models, at least historically. But I also see the opportunity. And I've also seen CROs try to do technology, but they were CROs first. And it's not really gone well. I think again and again and again, it's proven that it just doesn't work, that model. And so I think CROs do need to think about what this future again will look like and how they restructure their business around that. And if they don't, they're going to be like, I think the way I look at it is, at some point there's going to be like a first mover. Like one of the like more significant CROs is going to say, we're going to just get ahead of this problem. We're going to solve it because we want to stay competitive. Like I think it's almost like a game of chicken, like who's going to budge first? Because I think if the first significant CRO starts to change things significantly and starts to just say, hey, strategically, we're going to say goodbye to SCV as a revenue stream. And that's why we're now going to work with these tech platforms, and we're going to use these SOPs and these approaches, and we're going to recommend the sponsors to do X, Y, Z. And suddenly all the sponsors are like, holy shit, like with that CRO that is proven, my cost is going to go down 20%. Fuck yes, I'm going to go there. And then the other CROs are going to be like, shit, I gotta do something.
No, we have to do that.
But as long as they're all kind of looking at each other like, well, still just not do that. I think it's not going to shift. But I think like this is how this world works. And at some point, there's going to be someone strategic enough to say, we're going to get ahead of this, and we're going to have an amazing decade of business because we are the first ones to move on this. And we're going to benefit from that first mover advantage for a while. And obviously, it's going to go away, but at least it's going to be 10 years of our stock price increasing much faster than the market average, and that's fucking great. And everybody's going to get a better bonus for it, etc. And so I think that's kind of an important watershed moment that we need to see. But it takes balls, I think, because you're going to just really cut into an important revenue stream.
Yeah, no, it's true. I mean, either way, like you say, I mean, this is an extremely fascinating time to be in the clinical trial industry because something's going to change. Maybe it's not 100% clear exactly which way it's going to go, but I mean, there's too much pressure, I think, from all sides that there's going to be some significant shifts in the way things are done over the next few years, whether you're on the boat or not. I think it's going to be interesting.
Things are changing, right? It's not like something is going to change. I mean, things are changing. It's just almost imperceptible. Like, I think I look at e-consent and I'm like, why is that going so slowly? It's such a super easy, like of all the things you can do to make your trial more patient-friendly or more modern, I think e-consent is probably top of the list. It's also why we've invested heavily in it to really build a next generation e-consent. We really rethink how consent works and make it a lot more patient-friendly and benefit from. Like e-consent is actually the perfect example of the problem we discussed earlier in the call, right? Like, are we just replacing paper with DocuSign? Right. What the hell have we achieved here? Like, almost nothing. Yes, it's easier to archive if you don't have like a room full of paper. The whole point of using technology is that we do what the best consumer apps in the world do when it comes to onboarding people and onboarding customers and offering services. And like, we need to embrace that and rethink consent in the digital paradigm, which is what we're trying to do. But then adoption is surprisingly slow. But I feel like ePro has gone for the same thing. ePro now is very old and I think widely accepted. But I think when I speak to the old timers, there was a time where that was also like nothing, basically.
Yeah, but I mean, to that point, the ePro experience, at least in my experience, is still pretty bad. I mean, we work with 5 or 6 different ePro vendors, and frankly, they're all pretty terrible experiences for everybody involved. It's hard for us to actually get to the meaningful data. It's not easy for the patients. A lot of them, most of them that we work with, are still handing out these shitty old phones that don't work very well. They don't hold the charge. They break down, and we become sort of default tech support for a system we can't even see. So yeah, I mean, I'm with you, but I think circle back on that. Like, why aren't we seeing more like consumer grade experiences? I guess like, is it just, again, can we blame regulatory, or it doesn't seem like that difficult of a concept. There's millions of examples already, right?
Well, I think the answer partly lies in what you just said. Like, for some reason, all your ePro experiences have been like bad, and I'd love to learn why. But just that fact, I think, is important, because all those experiences slow adoption. And again, it's the risk. Like, it's just a combination of factors, right? Because I feel the FDA does want to see innovation. But everybody knows that what they did yesterday at least got accepted, and what they may do tomorrow,
Right.
You got to see. So the FDA could be like, yeah, go, like, do it. But the proof of the pudding is in the eating. Like, you want to actually see them accept that. And I think when you notice that there's issues with new technology, you're going to be like, well, that's probably not going to be as easy to get through as the original approach. So I think that just makes it a super slow process without, like, there's no one like really accountable. There's no way you can go to say, hey, innovation in clinical trials is lacking and it's your job to fix it. There's not like a single accountable person. So and then if no one is like, if there's no single person accountable or single entity accountable, no one is accountable, right? And that's why everybody's kind of looking at each other, and that's why this is going very slowly. And you have the tech vendors have obvious reasons to push this envelope, but ultimately they're only a tech vendor. I think that's pretty difficult problem to solve, and I think it just also requires a lot of patience, and actually patience. But I think the patient is going to be a main driver of that. I think as soon as we start to have more activist trial participants or patients that are saying, I'm just not doing this anymore. Like, I have seen the reviews of that sponsor and how they conduct the trials and how user friendly their technology is, and I'm not going to join your trial. I think that is ultimately going to be super important to help drive these things. But I mean, there's just so many factors that we'll get into getting them to actually say those things, right? So much education also, and so much more awareness of the differences between how trials are being conducted.
Well, I think transparency too, right? I mean, like, just even as a site, it's frustrating because, you can't go somewhere to learn like Y prime versus ERT, who has the better ePro system. Like, there's no place to know that. There's no way for anyone to know that. Everything's a secret, right? So since there's no transparency, you can't compare the two, and you can't say that, well, this one sucks and this one's great. And I think that's a problem, right? I mean, shouldn't there be some transparency? I mean, how can we better accomplish that?
I think this is where you should mention Clinical Trial Confidential, your platform. I mean, I think it's a good initiative to just try to foster more transparency. And I do think we are behind when it comes to like the reviews. So we have historically been, it's a while ago now, but on the Capterra, for example, just made sure we created transparency on how our technology worked. But I feel like it's not something we have seen a lot. There's a few other review sites now as well. But I think, again, a number of stakeholders need to just push for getting that information out there and getting it published and make it normal, like how successful was this trial and what technology did it use. But it's just, obviously it can be painful. And I also feel like a vendor can be wildly successful in a number of projects and then fail in a couple of others just for a number of very specific factors. But that's just the reality. And maybe it is reality that some vendors are better fit for one type of trial and vice versa. But it's I think also for investors, like obviously we have some investors that just come from a tech space. It's a pretty fascinating space to get into because they just have all these assumptions about how software as a service works and the level of transparency and accountability that comes with that. And we don't really see that enough, I think, yet in our space. But we will. I think we're going there, but slowly.
Yes, like everything, slowly. We're climbing the hill. We're climbing the hill very, very slowly. So
As soon as we stop climbing, as soon as we stop making progress, then we have a real problem.
true. That's very true. I want to shift gears a little bit. One thing I like to ask kind of all of the guests that come on is share, if you would, some sort of maybe tool or resource or something that just kind of helps you be the best Dr. Arts that you can be. I mean, it doesn't have to be clinical research related, but maybe anything you use sort of in your daily life that again just kind of helps you be the best you can.
Well, the best you can is, of course, broad. You can think like in terms of productivity. You can think in terms of just being a nice person that gives back. I think generally trying to not have an ego is a great start, which is hard, specifically for a specific group of people. So I read the book Ego is the Enemy, and I've gone very deep into Stoicism, and I think that is just friggin' amazing. So I think Stoicism, when you actually know what it is and what it isn't, is a pretty great life philosophy for a lot of things.
Yep, I'm a big Marcus Aurelius and Epictetus fan myself.
Yeah, good. I got some of that vibe from you, yeah. But I do think it's worth looking into almost wherever you are in life. I think it can help you, and I think it can help you also be a better person. So I think that's really great. I think the obvious things like exercise and really recognizing the mind-body connection are critical, and having very clear priorities for yourself, right? Like you can just say, look, I just want to work, and all I care about is work. That's fine, right? But just be honest about it. And if you have a family, be honest to them too. And if you do have a family, I think it's probably worth spending some time there and recognizing that time is precious and all those things. So just being very deliberate, at least being deliberate in where you spend time. And then as an extension of that, on more of the productivity side, I'm a big fan of getting things done. Just make sure whatever you need to do in life, it lives in a single place, so it never floats around in your brain. And you sort of lay in bed and then these things come up. Because if you have clarity on everything that you could possibly need to work on, you can at least order and sort it. And I think for me, the key driver to being productive and trying to at least be successful is every day knowing what is the most important thing I need to be working on. What is the thing that I am uniquely capable of doing that only I can do that I need to work on now? And if you don't actually have the full picture of things you could do, which it could include, I need a bank account, very sort of practical thing I'm facing right now. If you don't know all the options, then it's going to be very hard to prioritize accordingly. It's intimidating to do that, right? If I look at my list, they're always pretty intimidating, but I don't actually care because I know as long as I just keep every single day working on the most important things and I keep thinking about what that thing is, I do everything that is in my control, going back to Stoicism, and I'm going to go to bed feeling accomplished and feeling happy, even though I have 50 things left on that list. I'm I ordered it properly. I worked my ass off to get the most important things done. I spent time with my family. I was there in the moment. I spent the time where I wanted to spend it. Fucking A.
What more can you ask for?
Yeah. And I think sometimes you just need to exercise and get out there and clear your mind, because if you get too caught up into it, you'll lose these, you'll stop doing these systems. And if you just find yourself getting frazzled, you just got to basically say, I need a timeout. I'm not actually sure what's going on. I just don't feel right. Need a timeout, start journaling, write things down, reorder, go back to your system and reset. So that's a pretty long answer, not a single answer, but I think those things do work really, really well, and I think have proven to work well.
No, I love that. I agree with all of those points. Derk, where can people find you online or learn more about Castor?
So I'm mostly active on LinkedIn. Twitter is still just too much. I think it's going to just be too big of a time suck. But I'm very responsive on LinkedIn. I try to answer every message, also with a no, of course, sometimes. You can find Castor by just Googling it. You'll find it easily. We're at the big conferences. We're at DAA. We'll be at a couple of the big conferences also. So come find us, and very excited to tell you about what we think is important when it comes to technology in this space.
Awesome. Derk, I really appreciate you coming on. Anything before we wrap up here?
No, I love what you're doing, as you know. I look forward to spending more time together and to, maybe we should do a deep dive on some of these topics, right? Maybe I should invite you for a talk on why ePro isn't working for you, because I think those are the fascinating things that are actually most valuable. Not singing the praises, but just, getting that transparency on things that aren't working, but in enough detail so they're actually actionable. I think that'd be fucking amazing.
Agreed. I'm here anytime, man. Thanks again for coming on, and we'll see you next time. Thanks, Derk.
All right.
As always, thank you so much for listening to Note to File Podcast. Make sure to check us out at notetofilepodcast.com. I'd really like to encourage you guys to, leave a review, subscribe, reach out to me at brad@notetofilepodcast.com. Let me know what other kind of content you guys want to hear. That's it. Again, thanks so much for listening.